The issue that we have is, what do we do when we don't have all the info?
Dr. Stuart Ray is an infectious disease professor at Johns Hopkins Hospital. He's been studying viral transmission for 30 years. He says scientists are very busy right now trying to determine exactly what we're up against with the new Omicron variant.
The academics are looking at the specimens they have and looking at whether or not people who've been infected and people who've been vaccinated have antibodies that will neutralize this new strain, this new variant.
Meantime, vaccine companies have announced they're already working on developing formulations specifically for the new strain. But if you're considering putting off vaccination or booster until that happens, Dr. Ray says you shouldn't.
I don't think I would wait because there's nothing specific to wait for. In a few weeks, we're going to know more. But that's not going to mean that we'll have an Omicron vaccine booster for you. It's going to be months away before we would even possibly have an Omicron booster.
Although Dr. Ray points out that this new variant is very different genetically from others, he thinks there's a good chance researchers will find the current vaccines offer protection against it. And he adds that getting an Omicron-specific vaccine when it is available is no problem, regardless of how close it might be to your initial vaccine series or your booster.
There's not a too soon for that. We know that people can receive one vaccine and then, a few months later receive another, and it's not going to interfere. We can do that.
In the meantime, Dr. Ray says the best thing everyone can do is stay vigilant,
which is wearing masks and doing rapid tests and trying to make sure that folks who are positive on any test don't spread it to other people until we know more about the situation.
And so CDC officials also say that getting tested if you're sick as soon as possible will help them identify this new variant and let them know how quickly it is spreading. They're also urging everyone 18 and older to get a booster 6 months after initial vaccination. Reporting live in Midtown tonight, Kai Reed, WBAL TV 11 News.